Welcome to the orthoPAC podcast with your hosts Sam Dyer, Chuck Dowell, and Miles Gilbreth. Please join us as we attempt to fill in the gaps between education, current events, and real-world practice.
Hello, everybody. Welcome back to the podcast. My name is Chuck Dowell. I'll be the host for this episode. Today, I'm joined by Laura Goble. Laura gave an excellent presentation at our most recent PAOS meeting in Las Vegas regarding sports specialization. I think nutrition is a big aspect as far as orthopedics now. We're seeing a lot of nutrition pop up for pre and post-op support to kind of improve healing. How important do you think nutrition plays into this overtraining syndrome and these overuse type injuries these athletes are getting?
Yes, I think nutrition is very important. We see sometimes insufficient quality caloric intake. It's not that they're not getting the caloric max of the day, but what are they eating? If you're doing weekend tournaments and then practicing till after dark, trying to get a quality meal in for dinner or on the road can be challenging. And then if they're indoor athletes, another concern can be their vitamin D levels being lower because they're inside so much. And then the other part or risks for injury that we're seeing are, have they had prior injury? What's their training load as their bodies are developing? And then also the child's natural anatomy. Do they have a good technique, poor technique? And then what's their BMI and how much stress are they putting on their body?
What are your general recommendations? Let's say an athlete comes in and they're having maybe some overuse, they're having a little bit of overtraining, maybe some nutritional deficits. Like, how do you have that conversation? Because that's a hard conversation to have, especially with parents that are like, no, no, he needs to play. There's an important tournament this weekend.
Certainly. I mean, I think they usually are coming to me obviously because something is hurting, but it's giving us the opportunity to just kind of ask some of the open-ended questions like, tell me your diet, tell me your sleeping schedule, tell me what your school schedule is like as far as after school and what your activity load is. And sometimes just like laying it all out, I think helps identify maybe where people they need to combine how much time are they involving with their school teams, the community teams, and private lessons. And sometimes when the athlete is telling me their schedule, I'm exhausted just listening to what they're trying to do, not, let alone academics or extracurriculars with friends. Um, the nutrition, talking to them about, what they're eating, the amounts they're eating. I try to talk some, just making sure that they're getting quality calories, protein, fruit, vegetables, but also just like trying to remind patients to enjoy the sport, enjoy the process. And I also, I really try to say, listen, if you can give me 2 or 3 weeks, I think we can make this substantially better. I'm not trying to make you miss the most important things. And I'll even fudge a little bit if they're like, listen, we have this showcase and then we've got, a 2 week break, then we'll kind of say, okay, let's maybe let you do A, B, and C, but hold off on these events. So I think talking the lingo with parents and athletes, knowing as a formal, I mean, it helps that I was a formal athlete, but still trying to get into their world um, and learn about the actual schedule and what they have coming up to help facilitate their body to heal without missing important events, if at all possible.
Yeah, I agree. I think it's one of the things I've learned with time and again, being a former athlete, I think I definitely, am able to talk a little bit more comfortably with them, but I always kind of ask them, "Hey, what's your upcoming schedule? Do you have an
Mhm.
important tournament?" And as you said, if they have an overuse injury, I say, "What percentage do you think you can play at?" And if they could play at a high percentage with this injury, then maybe they're helping their team out still. If they can't play at a high percentage with the injury, then maybe they're more detrimental to the team than they are helpful to the team. And
Yes.
I try to explain all of that to them. And then, it's always more rest than they want it to be.
Oh,
Um, that
certainly.
that's the conversation. I think that's the most difficult part is we say, oh, you need some rest, and they say, oh, okay, 3 to 4 days off, and you're like, no, like 2 to 3, maybe 4 weeks off, and
Right.
like completely off. But as you said, that can be accommodated. Hey, I have the state playoffs coming up next weekend. Then go play and do the best you can, and we'll deal with it afterwards. Or in 3 weeks, I have the state playoffs. Then maybe just shut it down completely for 2 weeks. We can get you to 85, 90%. we're not going to get you to 100%. You have to understand that, but at least then you'll be better than you are now. And
Yeah, and I'm sure you do as well. Like I have a lot of athletes who are involved both in teams and school teams or rec teams. And so I
yep,
also try to make sure that the athlete, not the parent, the athlete is verbalizing what their favorite team is because I want to make sure they're healthiest for their favorite team and favorite sport because I feel like sometimes the parents are maybe adding some extra things on, and if the child isn't enjoying those as much, making sure that we're giving them the rest time in their least favorite sport so that they're ready and geared up to play with their favorite team and in their favorite season.
yeah, I agree 100%. Whenever I'm seeing these athletes, I always just talk to them directly. I don't talk to the parent. I try not to ask the questions to the parent. I ask it to the athlete. But as you said, I ask them, what's your priority? Like, what's your priority? Is your priority the club team? Is your priority this tournament? Is your priority, the season coming up in 2 months? What's your priority, and how can I use that priority to adjust the treatment? Based upon the symptomology. So yeah, I think we definitely approach it in very similar ways, but it's a hard conversation, especially with kind of eager and overbearing parents that, want them to play.
Absolutely. And then I do sometimes dive into if we choose to not rest now, what could this look like? What could the time frame that we miss because of this choice look like? Just so that they're aware of, the risk benefit ratio and can try to make some decisions at home too.
100%. I always say, like, you're going to turn a 2 week injury into a 2 month injury, and
Mhm.
that's fine. But would you rather miss 2 weeks now and be better, or would you rather work through it and miss 2 months, or be hurt for 2 months? So I think you have to just spell it out and be honest with them. And oftentimes the athletes are knowledgeable enough where they can make their own decisions and say, yeah, I understand and I can see, where that's coming from. So if we transition from that now into the ugly, so the ugly, you can't, you brought up a lot of common sports related injuries. What are the most common things you see, when we're talking about the ugly regarding sports specialization?
So almost all of them deal with growth plate primarily when it's overuse, training. We see a lot of stress reactions. These can be in gymnasts who are repetitively putting stress on their wrist, softball pitchers who have their plant leg and their distal femur growth plate gets irritated. Another common one is widening of the growth plate. So that would be like little leaguer shoulder where the proximal humeral physis is affected. Most of the time we see it in 11 to 16-year-olds where their growth plates are still open. There's apophysitis, like Seaver's disease, that's affecting at the heel area and inflammation around that area due to the repetitive stress. And that one specifically, most of them can also factor into growth spurts as well. And then probably the most common one we see in my office is Osgood-Schlatters disease with the repetitive stress at the tibial tubercle. Inflammation, swelling can be unilateral or bilateral. Most of the time, around age 14, the girls phase out, and by age 16, the boys phase out. And then apophysitis at the elbow, we're seeing a good bit too, just because of the high volume of travel baseball and pitching lessons, where that medial epicondylar growth plate's affected between ages 9 and 12, and the pain gradually is an onset and then starts getting more. And with this one specifically, a risk for an avulsion fracture can occur, as well as Osgood-Schlatters. But I feel like the elbow, just with the high velocity of pitching, can be at a higher risk for that. And then we also occasionally see osteochondritis dissecans, where there's avascular necrosis of the cartilage that causes joint pain, primarily in the elbow in the capitellum area. So most of them, though, are involving the growth plates that, again, just go right back to the age bracket that we're talking about and focusing on.
Join us again next week with Laura Goble, where we speak further regarding the topic of sports specialization.